Belk. This is my informative speech for Public Speaking 1 of spring of 2022. I have tried to film this video about 6 times now, and it kept deleting off of my phone. So if the camera quality is a little bit different, it's because I'm filming on my mom's iPad. Thank you, and now I'll begin my speech. Today, we hear a lot about heart conditions and their causes. The illnesses usually have to do with information regarding heart attacks and strokes. But one disease that seems to be hidden in the dark, most common in society, is congestive heart failure. Specifically, the causes and symptoms in women. The topic of congestive heart failure has influenced my life as long as I can remember due to my relationship with my grandmother. She has had the condition for decades, it seems, and I have seen firsthand how it affects a person and their family. My experience within my family has led me to find more research on the topic and educate myself, and inspired me to educate you guys as well on the topic of congestive heart failure. Congestive heart failure is a condition in where the heart does not pump blood as efficiently as it should. Despite what it's called, congestive heart failure is not when the heart has completely failed or stopped working. What it does mean is that the heart muscle has become less able to pump blood through the body, or even possibly a mechanical issue within the valves, according to Bloomingdale and Jones on my first resource within my outline. Dyspnea on exertion as well as is a well-recognized symptom of congestive heart failure. But it is not specifically just that. It can also result from obesity, anxiety, and many other conditions, according to Sorrento on my second resource on my outline. Specifically, congestive heart failure in women is a difficult topic. Most women who experience congestive heart failure are very passionate about educating others and teaching others due to the fact that it is often less talked about in society when it comes to talking about heart conditions. I know for a fact that my grandmother threw a fit when I posted a post in regards to the American Heart Association month of February being the Heart Month and educating people on stroke awareness. I did not know the exact specifics of congestive heart failure, and I didn't want to speak about something I didn't know, so I simply grabbed a fact from the American Heart Association, thinking, oh, this would be good to show people. And yes, of course, it's good to educate others, but my grandmother wanted me to know that the American Heart Association has little to no information in regards to congestive heart failure, and this needs to change. The start of congestive heart failure in women definitely arises differently than it does in men, and it's often less recognizable and often hidden. Unfortunately, there is no cure for congestive heart failure, but there are some treatments that aim to relieve the symptoms and slow further damaging from occurring. Treatments can include medical care, such as medications and surgeries, and also even lifestyle changes, according to Blumenthal and Jones. With this information, congestive heart failure should be taken very seriously. As soon as it's detected, these patients should be monitored regularly. Congestive heart failure can happen to anyone at any age, and it's important to monitor your body, especially if you have history of congestive heart failure, which is also known as CHF, so that you can take measures to protect yourself from extensive harm to your heart due to the condition. There are many causes of congestive heart failure, with no way to know exactly how to cure it, even with the amazing treatments that we have from our doctors today. The treatments that are used for the patients with congestive heart failure specifically depends on their needs and what they specifically need help with. Like I said, there's multiple different ways that you can get congestive heart failure. It could be a lack of the muscle being able to contract on the heart, or there could be a problem within the valve. So these specific medicines and the way that it's treated has to be designed for each specific patient with CHF. Like I was saying, overall, it is important to understand that congestive heart failure is not when your heart becomes to fail, but it is, however, the action of your heart becoming weaker. And this action limits blood circulation throughout your entire body. Now that I have explained to you what congestive heart failure is and the effects that it has on its victims, on a lighter note, I am hoping that my grandmother is less upset with me now that I have taken the time to further educate myself and you guys as well. I think it's important that we all understand what congestive heart failure is so we can educate everyone around us. Now, I ask you to take the information that I have given you and share it, spread the word, and educate others. Thank you.